Hello and welcome to my new crib. So it has been a few days since you all have seen me. I was moving and getting things ready to move and organizing. Still am organizing basically all day, Friday, Saturday, Sunday, and Monday and yesterday. But yesterday I actually did have a short-term medical plan appointment that I enrolled this lady in. And actually, let me back things up here. I actually had a PDP, a prescription drug plan enrollment for this Medicare couple on Friday as well. So I did do some work Friday and yesterday, and it was all around a couple sales, which is awesome. But today just did some more organizing around the apartment. I had a webinar that was really super exciting, and they had a bunch of hype and anticipation. And then they announced their 2021 Medicare Advantage plans, and it was very lackluster. But that's good, I guess. It wasn't a total waste of time. It was an hour and a half, which kind of sucks. But at least now that was the last company really that I needed to study or look at their benefits for their Advantage plans for next year. So now I know which companies and which plans will be the ones that I will be offering most to my clients for the 2021 Annual Enrollment Period. And it's currently 10 till 3. Do young people say that? Or should I just say 2:50 p.m.? I feel like whenever someone says like quarter till or half past or 5 till, it's always someone who's older that's saying that. Regardless, now it is 2:51 p.m. and I have a phone call with someone who cold reached out to me, I guess, cold DM'd me on LinkedIn, talking about some nationwide like insurance broker organization or collaborative or meetup thing. So I'm gonna talk to her and just see what that's all about. It doesn't look like they focus on health insurance, though. It's like literally every other line of insurance but health. So I don't know if I fit the criteria, so I'm just going to do a quick phone call with her to see if I'm able to be a part of that group, or even if I want to be a part of that group. And hopefully that won't take too long, because I honestly really would like to try to squeeze some sort of workout in. I don't know what I would do yet. The floor is concrete in our new place, and I just have the small rug around my desk, so I don't know what all I can really do in terms of working out. I'll figure something out. But I really want to squeeze a workout in, or some sort of exercise, because I haven't been able to, I've chosen not to squeeze time or make time for that since Thursday. Thursday was the last time that I did any sort of like routine exercise or workout. Obviously, a lot of walking and a lot of lifting and moving over the weekend. For moving, that sounded weird. A lot of physical motion, so I can't talk. Forget this. Essentially what I'm trying to say is I wasn't a total bum over the last 4 days. It's just that I haven't done a routine scheduled workout in a little while. But I will get back to you guys here after this phone call. Well, the phone call was decent. It was very quick and short, which was nice. Turns out they are taking health insurance agents in their network. There's no cost to me. I'm just able to participate in free studies whenever I want, and then I get the results of the research studies. And those studies are actually pushed off to the C-suite employees of different insurance companies, different nationwide insurance companies. So that's really cool. And then they said that they have virtual meetups, obviously right now with the whole lockdown and pandemic, but then after the world goes back to normal, they will be having potentially national conferences out in their headquarters in Boston, which would be really cool. So yeah, it'd be awesome to be able to meet other agents and other brokers from around the country that are not only in my field but also in other fields, and see what works for them, see how different markets do things differently. But then my day got way stressful. I had a client actually get declined for some crazy reasons. The letter that gave him more details as to why he got declined stated because of a couple things. One was type 2 diabetes, which he has never had. So that means some sort of doctor or provider put that he has type 2 diabetes on his medical record, and now that's going to be screwing him up moving forward until he figures out who put that on, why, and how, and if they can take that off his medical record. And the second thing he got denied for was this one prescription in particular that he said he never took. He said that someone wrote a prescription for him, like without his permission, and he said not to write one, but they still did, and he was very frustrated about that. And with that plan, him and his 2 kids completely got denied because he got denied, and this particular company and plan of this company does not allow for a child or children only coverage. So an unexpected left curve, and I am currently working on finding him and his kids an alternative solution to their healthcare coverage, which will probably include a hodgepodge of 3 different companies and 3 different plans. All right, so about an hour and a half later, I have a quote for him and his 2 kids, and it involves 3 different companies and technically 5 separate plans, and it's a nightmare. But I'm going to be getting a short-term medical plan for his 2 kids. He will not be on it. And so that will essentially serve as more of the catastrophic side, or the major expense part of the kids' healthcare coverage, because it doesn't really have any outpatient coverage and it doesn't have co-pays or prescription coverage. So that's the first plan. The second plan is going to be a plan that covers all 3 of them. It's guaranteed issue. It takes care of all their preventive coverage, as well as provides co-pays for outpatient primary care and specialist visits, as well as some prescription drug coverage. And that plan is $200 a month, and the first one that I mentioned was about $200 a month as well. So we're already up to $400. And then the last one is going to be a package of 3 different plans, 3 different gap plans, technically supplemental plans. One is an accident plan, one is a cancer and heart critical illness plan. Those provide lump sum benefit upon diagnosis of certain diseases. Then the last one is a hospital coverage plan that provides benefit of, what did I select? $1,000 for 3 days and for stays in the hospital. So it'd be $3,000 total paid out for 3 days. And then there's a couple riders on some of these, like an emergency care rider that provides a benefit for emergency room coverage, as well as a benefit that provides some reimbursement for an ambulance ride. And that package is just for him, just for the father. It does not include anything for the kids. And that is going to run about $67 a month. So all in all, this new package is going to be about $468 a month for him and his 2 kids. It's obviously a very wonky setup. It's out of the ordinary. It's not what I like to do, but this guy, our original strategy was totally cut because of certain conditions that the company said they found on his medical record that he actually didn't even have. And him and his kids have already been without insurance since July 1st. So we needed to get them coverage as soon as we could, as soon as possible. But the insurance company that we originally applied for said that they had no record of where they got that information, the false information about what's on his medical record, and that it would take at least 10 days for us to hear back. So I figured in the meantime, let's just get them set up with this, and this will be only a little bit more expensive and about the same coverage as what we originally had. Just a little more expensive, like I said, but it's just a much more complicated way of getting that coverage. And just for all the brokers out there or people wondering how commissions work on this. The original plan that I got him and the kids set up with was a 3-year, oops, that was really close, was a, not 3-year, 3-term short-term medical plan that went for 1 day less than 3 years. I know that's really complicated, just about 3 years. And that was going to pay me about $93, I think I calculated, in monthly commission. But then this new setup, obviously it's a little more, so it's going to pay me a little more. And some of the plans have higher commissions because we're looking at supplemental plans and some mech plans. So the monthly commission that I'll bring in for this setup will be roughly $125 per month. So not that much more than the old setup, but I definitely earned this one. Good evening, vlog. Good night, I should say. I didn't end up working out or exercising, which is kind of unfortunate. I just got caught up in too many things, unexpected things that always get added onto my plate, but that's the life of an insurance broker. Clients are always calling you with a problem, or you find out a client gets declined, like tonight. So I'm basically on call 24/7 for the most part. To some extent, I obviously limit my hours of work a little bit, but I digress. I didn't work out tonight, but later in the evening, I actually got a Medicare Supplement sale. I enrolled this client in a new plan that just released actually earlier this year. So I'm a little hesitant, but he lives in rural Nebraska. So it is, I just don't quite know which plan out there is the best yet. I'm still trying to figure out where or which plan is best for where he lives. And this one kind of landed right in the middle. It was a little bit less than the big name brand, the big dog in the state, but it was a little bit more than the no name, cheap B-rated company plans. So I figured it was going to be a pretty good fit. And also though, something that's pretty awesome that I realized is this plan has the highest commission out of any Medicare supplements that I am appointed to sell. So I get 26% off of his monthly premium. So I think I saw that is going to bring in about $30 a month-ish, I can't remember exactly. But $30 a month added to my monthly residual passive income. I just want to badger you guys and reiterate the importance of persistence and patience with this job, and then I'll head to bed here. But I realized I'd talked to this guy on and off for the last, I think it was 457 days. So when I first sat down and first met with this guy, it was May 16th of 2019, which sounds crazy saying that. But about a year and a half later of talking, we finally got him all set up on his Medicare plans, and he should hopefully be a client for life now. But that just goes to show you how long it can take to get a sale. And it shows you why you should always have some sort of system or list of people, prospects, leads, whatever you want to call it, that you follow up with every month or every couple weeks or so. Don't drive them too crazy. Don't make it very frequent. But just once a month or once every couple months, touch base with them and ask them if you can get a shot to review their policy. Maybe they told you no the first time. Maybe they didn't qualify health-wise the first time, but some time has passed. Or maybe they ended up going with another broker or another agent, whatever the case is. If they're not your client, put them in a follow-ups folder or follow-ups Excel sheet, whatever it is, and by God, follow up with them, because you never know when you might catch someone at just the right time and they say, yeah, I guess I will look into switching now, or man, my company just raised my rates, I need to find something cheaper. So persistence and patience, guys. We're in this for the long run. You got this. But with that, I'm gonna say goodnight to y'all in my new apartment. Don't worry, there'll be a tour coming soon. I'm excited to get everything all organized and all set in place. It's going to be fantastic when we're done. But thank you all for watching. I hope you learned something from this episode. There's a couple good key takeaways. then you got a real life case example, a real insurance setup, rolling with the punches, figuring out how to adapt to a situation where a client gets declined. And I gave you a little bit of a breakdown of Medicare enrollment. So you definitely learned something, I hope. Take care.